Want to track everything, go ahead. But we shouldn't not track this, because then we can't look at trends, as you've heard repeatedly. I don't want to repeat what I've said and what Representative Clara Desticcia has, but there's a lot of good data that can come out of that to help either prevent unwanted pregnancies, to provide access in certain areas. And we have to keep in mind, if we can also prevent a pregnancy, we prevent a probably very difficult and unwanted circumstance for a young person or a not so young person. And, you know, we're also paying for those services. So if we can prevent those, we can provide access, reduce healthcare costs. And if we want to have this be equal to everything else, then it should go through the Connie system. But we don't want to do that, and then we don't want to collect it. And I'm not sure why there's such apprehension to collecting data when we collect it on every other procedure. That's all. Thank you.
Thank you, Senator Summers. And you're making some good arguments as to having minors access to contraception. I'm giving you a hard time and teasing you on that. We have Representative Kavros DeGraw to be followed by Rep. Berger-Javallo to be followed by Rep. Gilchrest. Representative Kavros DeGraw.
Thank you, Madam Chair. I think part of the conversation that I have not heard tonight is the larger context in which we are having this conversation. I understand the need for us to have data on certain procedures. I understand that people may want to be able to see trends. The challenge with this topic, which both speaks to the exceptionalism and to the fact that it is a difficult conversation, is that in the larger context of the wider world of not just Connecticut, but the country, there are people who are accessing people's private data. There are people who are doing, we don't know what with that data. Even the company 23andMe is going bankrupt, and people are freaking out and trying to figure out how to delete their data. So while there is a larger conversation about data, you know, for some women, the day they have to have an abortion can be one of the worst days of their life for a variety of reasons. For some women, it's a freeing day. And I think that, you know, trying to find trends is almost more judgment being placed on the procedure. So I think that as we are talking about this, we have to think about the wider context of how data can be manipulated, about how data thefts happen. And I certainly think, considering all we have done to protect privacy in the state of Connecticut around this topic, I don't want to see us go backwards, and I think that that's part of what this does. And so I do hope that my colleagues will be voting no as well.
Thank you.
Thank you.
Representative Kavros DeGraw. Rep. Berger-Javallo to be followed by Rep. Gilchrest.
Thank you, Madam Chair. And really just kind of tapping into what Rep. Kavros DeGraw just said and taking it just a step further, given statements made by multiple members of the current presidential administration, as well as a memo that came from Secretary of Transportation Duffy, we are looking at a very different world than we were when we were talking about reproductive care in any previous sessions. We can't pretend that this is the same. We are talking about elected officials who have very clearly stated that they want to monitor pregnancy, they want to monitor women's health care, they want to monitor birth rate. And I think that this becomes a very different conversation, and I just think it's important to remember this isn't the same world we were having these conversations in last session before. That's all. Thank you so much. Appreciate the indulgence late in the night.
Thank you, Representative Berger-Javallo. Representative Gilchrest.
Thank you, Madam Chair. And to the proponent of the amendment, and it is late, so my apologies. Can you speak to, again, what you mentioned of why it would be important to collect data? What could be done with the data?
You know, I think I've repeated myself plenty of times on this. And, you know, if you don't agree with collecting the data, that's fine. I agree with collecting the data. We have heard repeatedly from here that we need to treat abortion like every other procedure. Then it should be part of the Connie system. But this particular is carved out. So Connecticut collects healthcare data to improve health outcomes, control costs, promote equitable access to high quality healthcare, and it's based on data analysis. Instead of calling it abortion exceptionalism, maybe we should have extraordinary data that we can make sure that we're making the correct policy decisions that help all women in the state of Connecticut. Again, this is de-identified data. We could look at trends. We have repeatedly, many of us have repeatedly says, if we get the information from DPH and we find, let's say that certain women of a certain age and a certain demographic, we're seeing a high spike in abortion. We have an opportunity there to do education, to provide birth control, to work with our community healthcare workers to make sure people know they have access to prenatal care if that's the way they want to go, or to make sure that they know that there is a choice for abortion services, etc. But without the data, we don't have any of that information. We don't know at what stage abortions are being performed. So we could put more emphasis on, early detection, etc. We don't have any of that. And what do we say to the people of Connecticut when we are collecting data on every single other procedure through our Connie system, which is not easy to opt out of, when somebody says, well, what are the trends in X, Y, and Z? How do we respond to that if that data is not being reported to the state of Connecticut? We don't. We say, we don't know because we don't collect data. We don't know how many of these are done, who's getting them done, where they're getting them done, what the trends are. We don't know because we don't collect the data. We've decided to not collect the data. But every other procedure, we are collecting data. So we either are in or we're not in. We are either going to collect the data and treat this like every other procedure, great. Or we are going to protect it and make sure it's confidential, because there's questions I just heard tonight that Connie is not confidential, which is exactly what's happening currently. It's held for 2 years in a confidential file. Nobody's using it for any nefarious reasons other than looking at trends and where we go from here. And remember, the state of Connecticut is paying a lot of money for these services. I would rather have them be able to do preventative so that we don't put a woman in a position where she has to make a choice that may not be a pleasant one, to say the least, for her and her family or her friends or her decision. So that's all this is for. I don't understand the hesitation to this. I don't understand why we wouldn't continue doing what we're currently doing. That is causing no harm, just gives us information when we get information on every other procedure. So that's my opinion. Clearly, I understand that most of you will not agree with me, but I think it's important to address this. Thank you.
Thank you, Madam Chair.
Thank you.
And how long have we collected the data currently?
I can only say that it's in the current regs. I don't know how long that's been.
Do you know if the data that's been collected since the regs have been in place has been used to control costs and improve health? I know you did mention using it to tell constituents how many abortions are performed, but has it been used in the manner you've spoken to tonight about improving health outcomes and controlling costs? Through you, Madam Chair.
Thank you, Representative Gilchrest.
I know that we have asked, through you, Madam Chair, in the past, not this year, but in the past, maybe I've been on public health for, this is going to be my 9th year. So in the past, we've asked to look at the data and the trends, how many people are having them at this age, how many are done in the first trimester, the second trimester. I know that we have asked that for that information from DPH, and I have gotten that before. Thank you.
Thank you, Senator Summers.
But to the best of your knowledge, it hasn't been used in any concerted effort to make policy change. Through you, Madam Chair.
Thank you, Senator Summers.
Actually, through some of that data, many of us, I know myself and Representative Claritas Dietria, we had put in bills to make sure that Plan B was available by a vending machine in colleges, that we made birth control more accessible through our pharmacists, et cetera. So that data had a lot to do with the bills that we, and the policies that we did submit. So I would argue that, yes, it has been used in policy decisions when we submitted bills.
Thank you, Senator Summers. Rep. Gilchrest.
Thank you, Madam Chair. So you're contending that the decision to offer emergency contraception on college campuses via a vending machine was based on abortion data from the state of Connecticut? Through you, Madam Chair.
Thank you, Representative Gilchrest. Senator Summers.
I'm saying it was part of a tool in a toolbox that made us be aware of what was happening and to try to provide access to care when something happened for Plan B that would help you prevent having an unwanted pregnancy. And that was part of the reason to submit bills that we have. Yes.
Thank you, Senator Summers. Rep. Gilchrest.
Through you, Madam Chair, does the abortion data that's currently reported to the Department of Public Health break down if the individual accessing abortion care is a college student or not, through you, Madam Chair?
Thank you, Rep. Gilchrist. Senator Summers.
No, but it talks about the age of the woman.
Thank you, Senator Summers. Rep. Gilchrist.
It also says where it's being performed. Sorry.
Rep. Gilchrist.
Thank you, Madam Chair. I am guessing, based on our conversation of when the regulations were implemented back in 1991, and it took about 5 years. So if we've been collecting data since 1996 here in the state of Connecticut, and the answers I got are the answers I just got, I don't see the need to continue to have the state collect this data when we know that the providers performing abortion in the state would collect it themselves. I agree with the statement on exceptionalism and would ask my colleagues to oppose this amendment. Thank you.
Thank you. We have Representative Mara to be followed by Representative Martinez to be followed by Senator Gordon.
Thank you so much, Madam Chair. In some ways, I believe the exceptionalism may be the other way with abortion services, since it's actually carved out of the Connie program. But I had heard some of my colleagues ask where in statute reporting is required. And I'm sure it is in several places, but